Hi guys, my name is Natalia Mena. I am a registered dental hygienist in the US and I am also the founder for dentalehub.com. So today I want to talk to you about a unwanted topic, and that is interdental cleaning. Okay, so we're told that besides brushing, we have to clean in between our teeth every single day, preferably before bedtime when we're extremely tired. Like seriously, who has time for that? Well, the thing is that even if we don't have time for it, we do have to make time for it. Because if we don't, we'll most likely get puffy gums, red gums, bleeding gums, bad breath, cavities in between our teeth, tartar in between our teeth, and it can actually get worse. But for now, we'll just stop right there. Okay, so isn't brushing enough? Unfortunately, no. See, the thing is that when we brush, we remove the plaque and food from the surfaces of our teeth, but there's still food stuck in between our teeth. And if it starts rotting, we don't want to talk about the rest. Okay, so in my 10 years as a clinician, I've heard all kinds of answers when I ask people if they floss. So it's yes, sometimes, not as often as I should. Once before Christmas, or flossing? What is that? Well, let's go over a few methods. To make it easy for you guys, I've noticed that there's so many things out there in the market. So we can obviously get confused about what to use. The first thing that they tell us is floss. But what is essentially flossing? Or what is it exactly that we want to do when we have interdental cleaning? Now, flossing definitely works for everyone and everything. But what we are concerned about is actually removing food from between our teeth. That is the objective. And so in my 10 years of clinical, I have found 3 methods that really work well. Okay. Now, this is going to depend highly on what we call the embrasures between your teeth. And what the embrasures between your teeth means, those spaces in between your teeth. So how apart are your teeth? Like, so obviously you don't want to put something in there that is too wide, that it's going to damage your gums. So there are 3 that I usually go with, and usually they fit my patients. Okay, so the first one, obviously we've all kind of heard about it. It's going to be your floss. Now we have different brands, different options, different width. We have what's called a tape, satin. We have so many options. So I always tell, what I would like to tell you guys is ask your hygienist which one is best for you, depending on what's going on in your mouth. So your floss, it's gonna be one method for those people that have very small spaces in between and they can't fit nothing else in there. The other option for people that cannot fit anything else in between is a water flosser. Now here I am showing you the Philips Sonicare air flosser, which is the one I have currently at home. But there's 2 brands that have great reviews, and they also have a lot of clinical studies behind them. And that's going to be your Philips Sonicare air flosser, and you also have your water pick. Water pick is fantastic as well. It has been around forever, and it has different options. So one of the options it has is on the counter, you plug it in, the traditional one. The second one is kind of like this, so it's more portable. You can take it with you anywhere. And the third option, which I personally love, and I think that patients have a lot of success with because they don't have to really think about it, is the one that attaches to your shower head and you can actually floss in your shower. And the other option that a lot of my patients really love, and I love it as well, I've loved the results that I've seen with my patients going from non-flossers to actually having very healthy gums. And that is going to be your interdental brushes. Okay, so they look like this. Where's the other one? They look like this, and there's 2 brands as well that I really love and that I feel comfortable using and recommending. So one of them is Interprox, okay? And this one, they come in different sizes. So again, you want to make sure that your dental hygienist or your dentist measures you for the correct one. You don't want to be jamming anything in there that does not fit. Again, and also if you have bigger spaces, you want to make sure that you get one that really and thoroughly removes everything. The other brand that I like a lot is TP as well, and both of these work really great. So these, you basically extend them with their cap, and the Interprox one is very flexible in the body, and it's also flexible at the top. So it's really nice for those people that have a really hard time getting to the back. So these are very easy to use. My patients that are not motivated or have a lack of time find that they're very versatile. Okay guys, so there you go. Those are 3 methods. Again, there are so many other ways and so many other products in the market, but if you use one of these 3 methods, I assure you that you're gonna be super compliant and be on your way to a very healthy smile. Please make sure, again, that when you visit your dentist or your hygienist next time, that you do go over it. Don't be shy to ask them. If they tell you just make sure you're flossing, then don't be shy to ask questions and ask them, I don't know how to floss, can you show me? Or I'm not really into using the floss, can you show me a different method? And I'm sure they will be more than happy to do that. And if flossing is your only option, for those that the floss is your only option, make sure that you're doing it right. I have found also that many patients, when they're using the floss, they're not using it correctly. So go over it. There's no shame in asking your clinician. They're there to help you. They're there to teach you the best of ways, and they will be happy to see you succeed in a healthy smile. Don't forget that a healthy smile affects the rest of your body and your health. So you want to make sure you keep up with that. And the good news is that if you do this for 7 to 14 days consistently, you will see a great and dramatic change in your health, in your gum health. Again, my name is Natalia Mena, founder of Dental eHealth and registered hygienist in the US. Make sure to give us a thumbs up and share our video. Thank you.